Welcome to Season 12 of the Social Work Rants Podcast, providing an inside look of the social work mental health profession. Social work being political, the struggles of social work entrepreneurship, the intersectionality of mental health and finances as it relates to social work and society as a whole. Let's get it. Hope you enjoy. Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants Podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in and tapping in wherever you are watching or listening to the podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to follow the podcast on Instagram at the Social Work Rants Podcast. That is all one word. Of course, the YouTube channel, hit that red subscribe button, leave comments, leave a 5-star review. If you listen on Spotify, definitely leave comments. I do respond to the comments on YouTube. I do respond to the comments as well. So shout out to y'all for keep rocking. This episode is dedicated to those of you, to therapists, those doing individual, family therapy. This episode is for you if you are a new graduate interested in doing individual therapy. This episode is for you because uh, your money's going to be affected somehow, some way. So recently, and I'm purposely jotted down some notes from what I've seen, like online and from other therapists in the field experiencing these reimbursement issues, especially if you're billing Aetna through the Alma platform. A lot of these platforms that started after the pandemic, supposedly trying to provide an additional support, mental health support, but these VC, private equity and venture capitalists put money into these type of programs to provide mental health services, but it's uh, at the end of the day is a kind of a money grab from what I've been seeing. So recently, Aetna announced changes to reimbursement rates for providers billing CPT codes 90834 and 90837 on the Alma platform, effective July 15th. And again, this is specifically for those of you who are using Alma to get clients and are got to use their system. Um, they're quick to, kind of easy to get you, from what I've seen, easy to like help you get clients and build up a caseload so you can see folks and get paid. But these codes and how you bill are going to change. So starting July 15th, the CPT code 90837, that's for any session 53 minutes and up, will be reimbursed at the same rate as code 90834, which is a 37 through 52-minute sessions. And again, this is on the Alma platform. So we are still dealing with inflation. Inflation recently, a report came out, we're at 4.2% inflation rate as a nation after President Biden got it down to 2 point something after it was like over 4 before he took office. So dealing with inflation, I've said this plenty of times recently on the podcast. Everything is going up except the check. Um, Taxes, insurance premiums that we go see the doctor, food prices, the gas price has been going up because we're dealing with a war with Iran. Gas prices has gone down a little bit, is depending where you live at, not fast enough. So now your money is going to be affected by doing the great work that you're doing as a therapist. Um, In addition to Headway, which is another platform, is visually scanning patients for their sessions. So we have a whole technology issue against our code of ethics, scanning patients. I don't even so everything's been seen on the news about surveillance state of folks, the lack of privacy with cameras everywhere is happening in mental health. So, and then audits are being done for agencies, and payments have to be reimbursed. So, agencies are getting funds, and again, it's kind of like separate from the Alma and Aetna situation, but again, reimbursements, the whole purpose of this episode, reimbursement issues are being affected throughout, the mental health field if you're providing, individual therapy, and audits are being done, you know, affecting organizations. So now we're dealing with potentially people maybe losing their jobs, um, or hours being cut back. So it's affecting your money, affecting your pockets. And shout out to multiple time guest Justin Gillespie. He is because Blue Cross Blue Shield of Michigan, again another uh, healthcare provider. There's issues in Michigan in terms of reimbursement rates as well, and he's actually doing some macro work and trying to produce a bill in Michigan to deal with reimbursement rates, and he's hoping to get it on a national level uh, as well. So shout out to him for that. Um, there's and again, in addition to the Alma and Aetna situation, there's a payer regulation changes that are happening. Members, especially specifically for folks who have no Medicaid or Medicaid attached with an HMO, like they're experiencing higher denials, uh, issues with recertifications, organizations receiving over a 70% increase in Medicaid audits. And in some cases, that money got to be paid back. So I'm talking about a lot of nonprofit agencies that bill for Medicaid services are dealing with audits now. So there's potentially of that might lead to more nonprofit closures. I just saw something on the news, or at least on the news or on Instagram about New York City, where born and raised that, nonprofits are having issues. There's a budget issue happening in New York City that's affecting nonprofits getting paid to pay their bills and pay their staff. So that might be forced for more nonprofit organizations in New York to be closing. So a lot is happening, and the full extent of the HR1, better known as or not greatly known as the One Big Beautiful Bill, or Big Ugly Bill, whatever you want to call it, hasn't fully even kicked in 100% yet, and that, according to news sources, depending on who you listen to, that might not fully be seen after effects until after the general election in November. So if you got clients on the Medicaid side, um, we'll tell them to be mindful of Medicaid recertifications. There's also a new work requirement that's coming out in July for folks potentially got to show proof that they're trying to work or whatever up to like 80 hours in order to maintain their services, their Medicaid, their food stamps, and things of that nature. So it's going to be a hot mess. I've been saying this for a while. Things are going to get a lot worse before they get better. This is educational purposes to educate you. Part of my duty under the code of ethics to give back to the profession and providing this sort of education for folks. If you're doing the work, you need to know what's going on, why things are happening that didn't happen before. So the Agent Orange administration is doing a lot of things that's affecting the most vulnerable populations, making our jobs as social workers a lot harder than it already is. So just be mindful of what is happening. Um, like I said, going back to the inflation, your money is going to be affected one way or another with all of these changes. So if you're experiencing any of this, um, and again, from what I've seen online, if you're independent, like doing therapy independently without doing using these platforms such as Alma and Grow and Headway, there hasn't been any sort of changes in terms of these billing codes as of yet. But I'm sure these organizations in capitalist America, you, things kind of like go in circles, and like if one organization is doing it, everybody else is going to follow along potentially. So if you're being affected by this, definitely leave a comment. Let's a little more of what is going on, because this will probably be kind of a more be talking about it more throughout the summer and going into the fall, and with the general election coming up, it'd be more important to see what these what the after effects of the Trump bill is going to have on us as social workers doing the work that we're doing. So, um, on a side note, to end this episode, if you live in New York State, if you have family in New York State, or if you're a caregiver in New York State, you have family in New York State, your best friend is in New York State, I'm hosting a webinar uh, Thursday, June 18th. Next Thursday, June 18th, 8 p.m. It's $15 per person. Caregiving in New York State, a public health crisis is the title of the webinar. Uh, Definitely tune in, tap in. A lot of information talking about PACE programs, talking about financial struggles of caregivers, what we could do about to kind of like fight back, or who to reach out to for services. Uh, a lot of information, good information for folks, even if you're not in New York State and want to learn more about issues of caregiving. Myself being a caregiver, I'm put the link in the show notes, and I hope to see you next Thursday, June 18th, 8 p.m. New York time, Eastern Standard Time, and I hope to see you there. On that note, have a good week. Stay safe, folks. Peace.